Welcome back to New Jersey Power and Politics. I'm Alex Sedan. This week, New Jersey's expanding case count of COVID-19 made our state second only to New York as the hardest hit state in the nation by the coronavirus pandemic. Dr. Perry N Halkitis is the Dean and Professor of Biostatistics and Urban Global Public Health at the School of Public Health at Rutgers University. He is a public health psychologist who has spent nearly 2 decades researching HIV and other infectious diseases. Dr. Halkitis, thank you very much. Welcome to the show.
Thanks for having me.
Based on what you know right now, how much worse is coronavirus going to get in our state and our nation?
The indicators suggest that at least for the next month or so, the country and our state will continue to see infections rise rather dramatically. Given that we are not testing everyone and given that we are testing only individuals who are showing symptoms, we have no idea where the disease actually exists. But every indication, every mathematical model that I looked at suggests that the next 6 to 8 weeks are going to continue to be a challenge for our state and for our country.
And the next 6 to 8 weeks, when you talk about that period of time, are you talking about potentially hospitals getting overwhelmed? Are you talking about extensive social distancing during that time? Can you map out that 6 to 8 weeks for us?
Absolutely. I want to step back and sort of play out, first of all, the idea of how the coronavirus is going to manifest itself. I think it's very, very important for us to remember that what we're seeing in the media are representations of the most horrific cases. So while there's a possibility for the pandemic to spread very widely, the majority of people in our state, the majority of people in our country will not develop those symptoms, and only 1 to 3% will die. However, the fact that 20% of those who are infected will develop complicated symptoms due to respiratory failure, one, has implications for our health care system, which simply does not have enough beds, does not have enough respirators, does not have enough space to treat those who are truly, truly, truly sick. And so the healthcare system is going to be taxed, but also we as human beings are going to continue to be taxed, because if we really want to contain this virus even more and be even more effective, we have to be even more vigilant about self-isolating and keeping indoors.
Doctor, these isolation methods, the social distancing, when are we going to know whether or not it's working?
I mean, I think we do see that it's starting to work in places that have actually implemented them. When you see what's happening in San Francisco, and you see what's happening in Washington, and you see the rates of hospitalization in New York City, I think there's some glimmer at the end of the tunnel that these are beginning to work. The bottom line is we're dealing with something that we cannot see. And I want to say something that's really important for the viewers to remember. Again, 80% of people who are infected will either have mild symptoms that feel like a cold, like any other cold, or no symptoms at all. Those people tend not to self-isolate and could spread the disease very easily. So there is hope. I think in the absence of any treatment whatsoever, it is the best thing we can do if we want to protect the well-being of those 1 to 3% of the population who are the most vulnerable to this disease.
So Dr. Halkitis, do you think that there's been an overreaction?
No, I don't think there's been an overreaction whatsoever. I actually think that perhaps, look, if there are 2 extremes, right? One extreme, do nothing, let everybody go about their business. The other extreme, the Wuhan province, where everybody was sort of rounded up and kept in their homes. If I had a magic wand, if I could solve this problem by myself, I would have everything shut down for 6 to 8 weeks so that the infection can stop spreading. I just don't think we know how widespread it is. And we're very fortunate to live in a state like New Jersey, where actually science is guiding the way. So we are probably on top of it. New York, New Jersey, Connecticut, Washington, California, much more than other parts of the country. I worry deeply about the rest of the country that is not implementing these strategies.
Can you talk to me a little bit about how infectious COVID-19 is and how it compares to other diseases?
Yeah, so like all viral infections, like flus and what have you, it is infectious. The problem with COVID-19 is that it can be passed from person to person within a short distance, through the air. It can be passed through surfaces. It is extremely highly infectious. I actually wrote an editorial last week comparing it to HIV. HIV, much less infectious, many more people died. Here, the disease is very infectious. It is very easy for people to pass it from one person to the next, particularly problematic when a person is not aware that they actually have the virus in their body. So highly infectious, best to stay away from people as much as possible.
Last question for you. As much as we're going through now, what's the possibility that there could be a second wave of this virus, this disease, coming through in a certain period of months?
It's possible. It's possible. It's very possible. I think that this is a learning moment for New Jersey, and this is a learning moment for our country. First and foremost, I hope we take this lesson and have plans that are a little bit more automated and a little bit more based on artificial intelligence than we are right now. Right now, we're depending on human beings to make decisions, and I don't always trust human beings to make the best possible decisions. But it's very possible, if we don't contain this, if the country begins to open up, that the virus will just continue to spread. And you know what? If people in another state, state X, are in an open space where there are no restrictions, and those people come back to New Jersey, then they reinfect our population. So the health of each state affects the health of other states. So we have to be in this together as a nation, not as individual states fighting it one-on-one with the virus.
All right, well said, Dr. Halkitis. Thank you very much for joining us. Dr. Perry Halkitis of the Rutgers School of Public Health, thanks for being on.
Thank you for having me.
And as for you, please stay with us.